All right, so in our last two sessions, we've really dug into the power of health data. But today, we're taking it a step further. We're going to put on our detective hats and join the public health officials on the front lines. We're going to see how they use maps not just to find a disease, but to actually tell its story and, hopefully stop it dead in its tracks.
So this is the big question, right? This is what public health officials, our health detectives, are trying to answer every single day. It doesn't matter if it's a well-known enemy like malaria in Kenya or some new, scary virus popping up, the mission is always the same. Find it, figure it out, and shut it down. But where do you even start when a crisis is breaking out all around you?
Well, to solve a mystery this big, you can't just guess. It's not going to work. Health detectives need a very special kind of map, one that shows a lot more than just roads and rivers. They need a map that can show where the disease is, how it's moving, and, this is the key part, why it seems to be thriving in one place and not another. And to build a map like that, you need a whole field of science behind you.
And that field is called spatial epidemiology. Now, I know it sounds super academic, but the idea at its heart is actually pretty simple. Your geography matters. Your location matters. It's the science of understanding the where and the why behind health problems. It helps us see patterns that we'd otherwise miss, connecting sickness directly to a place on the map. For our health detectives, this isn't just a tool, it's the tool.
Okay, so every good detective needs clues, right? For a spatial epidemiologist, those clues are data, specifically data that you can actually plot on a map. This is what we call spatial data, and it's what turns a plain old map into this living, breathing story of an outbreak, revealing these critical patterns one clue at a time.
Now, these spatial clues, they aren't all the same. They actually come in three main flavors, and each one tells our detectives a different piece of the story. So let's break them down.
First up, we've got point data. This one is pretty straightforward. Just imagine putting a single pin on a map for every single confirmed case. So, for example, during an Ebola outbreak in a West African village, epidemiologists would map the exact household of every sick person. And that kind of precision is just incredibly powerful. It can immediately show you if cases are all clustered around, say, a single water well or a marketplace, pointing you directly to where this thing is spreading.
Okay, next up is area data. So instead of individual pins, here we're zooming out a bit. We're grouping information into bigger regions, like districts or provinces. Picture a map of Zambia during a cholera outbreak. By coloring in each district based on how high the infection rate is, officials get this amazing bird's-eye view. They can see in an instant which regions are getting slammed to the hardest and then rush resources like mobile clinics or clean water to exactly where they're needed most.
And finally, we have what's called continuous surface data. This is for mapping things that don't really have clean borders, stuff like temperature or rainfall or air quality. Think about the fight against malaria across East Africa. Scientists can map out temperature and humidity to create what they call a risk surface. It's basically a heat map that shows exactly where the conditions are perfect for mosquitoes to breed. This isn't just about tracking an outbreak anymore. This is about predicting where the next one could happen.
But here's the thing. A location is still just a dot on a map. To really understand the whole story, our detectives need more context. They have to know about the people who live there, the environment they're in, all the little details. This is where they start layering on even more essential clues to get the full picture.
And these extra clues usually come from three key sources. You've got health surveillance data, which gives you the raw numbers on the disease itself, how many cases, who's recovering. Then there's census and demographic data, which tells you about the population, how old they are, how crowded the area is. And then there's remote sensing data, usually from satellites, which gives you that crucial environmental picture of the landscape.
And that last one, the environmental data, is absolutely critical. It's a total game changer for vector-borne diseases like malaria or dengue fever, which are, huge challenges across sub-Saharan Africa. Satellites can see things that a person on the ground just can't. Subtle changes in vegetation that signal recent rainfall or the exact location of standing water. All of those are potential breeding grounds for mosquitoes, and this data helps officials find them before they become a massive problem.
So we've got all our clues, right? We have individual case locations, we have regional hotspots, we have population data, and we have satellite pictures. But they're all just pieces of a giant puzzle. The real magic, that aha moment for our detectives, happens when they start layering all these pieces together.
And this is really where it all comes together. Just look at how combining these different data sets leads directly to action. You combine specific case locations, that point data, with census info, and boom, you see an outbreak is concentrated in a really dense urban area. So, what's the public health action? you deploy targeted vaccination campaigns right there. Or maybe you combine the regional area data with surveillance numbers and see that deaths are rising in one specific district. The action? You get more hospital resources to that exact region fast. And finally, you overlay that satellite imagery showing heavy rain with case locations, and you immediately see the connection to mosquitoes. The action is crystal clear. Start mosquito control measures. See? Each combination draws a straight line from the data to a life-saving decision.
So, at the end of the day, what's really important to get is that spatial epidemiology isn't just about making cool-looking maps. It's about taking all this scattered information, all these different clues, and turning it into real, actionable intelligence. It gives officials the clarity they need to step in at exactly the right place at exactly the right time to save lives and protect whole communities.
And you know, the technology for gathering and analyzing all this data is getting better and more powerful, literally every single day. The maps get more detailed, the data gets more precise. It kind of leaves us with this really exciting question. With these incredible new tools in our hands, what huge health mystery that affects all of us will these detectives solve next?